I'd like to commence my contribution to the debate by extending my warm congratulations to Minister Helen McEntee and wish her all the best in her new role. I believe you'll be a good Minister of State with responsibility for mental health and for older people. It is now 10 years since the Vision for Change, which is the report of the expert group on mental health policy set up by the then Minister for Health, Tim O'Malley, and its foreword it states, each citizen should have access to local, specialised and comprehensive mental health services provision that is of the highest standard. This should be our objective as we set about trying to secure resources for mental health. Let's first of all take a look at the cost of mental health to our society. Mental illness causes both social and financial damage, with the Mental Health Commission estimating that the cost of poor mental health is 2% of GNP. The mental health and population of Ireland is an essential foundation for economic and social recovery. More than 450,000 people in Ireland experience depression at any one time. This represents 1 in 10 in our population. People with a mental health disability are 9 times more likely to be outside the labour force. Spending on the delivery of mental health supports is scandalously low. According to the College of Psychiatrists of Ireland, annual expenditure on mental health is 6.2%, which is extremely low when you compare this to countries such as the UK, which is 12%, and Canada and New Zealand, where it's at 11%. The Vision for Change mentioned at the outset of my contribution proposed an annual expenditure of 8.24%. The low level of expenditure on mental health needs to be addressed, and we must start this at the next budget. The number of suicides in Ireland has remained high, with between 495 and 554 deaths per year from 2009 to 2012. We saw that when a focused set of policies backed by adequate resources, supported by government policies and state organisations, was put in place to deal with road deaths, reduce significant road deaths that used to occur in our road network. We must give mental health the priority it deserves to enable us to deal with the level of suicides in Ireland. It is in the 2016 budget submission, College of Psychiatrists of Ireland put forward a number of positive proposals to assist in developing a policy platform for mental health. It included the following: the provision of community-based mental health teams for patients of all ages on a 24/7 basis nationally. It stated that this must be a priority if inroads are to be made into the continued morbidity and mortality due to suicide, self-harm, chronic mental illness and alcohol and substance abuse. It also proposed a nationwide recruitment of recommended professionals to fully resource the teams, giving people in need coordinated professional support where and when they need it. The Vision for Change document delineates the type and numbers of mental health professionals who should be involved in mental health teams in each area nationally. Proposed a multi-annual allocation funding, beginning with a 5-year rolling budget of incremental, increasing to a minimum of 12% of GDP. I would like to acknowledge the work of many advocates in this area and give a special mention to Dr John Hillary, Director of Communications and Public Education of the College of Psychiatrists of Ireland, who is passionate about advocating for the people with mental health challenges. Locally, I see in my own constituency of Kildare North the benefit of having a daycare psychiatric service in Kilcock. Users of this service contacted me recently when their service was threatened by cutbacks. I was delighted that the service was maintained, but I see the distress and anxiety caused by threatened cutbacks on people using the service and the benefit that they derive from it. Thank you, Concordia.